Central Phlebotomy Exam Practice Test 2025-25 Real Questions Answers. Question 1. The gauge of the needle refers to the length, the diameter of the bore, the color of the hub, the material. Larger numbers mean smaller diameters. Question 2. The SST tube stands for simple serum tube, serum separator tube, single source tube, sodium salt tube. Contains a gel to separate serum. Question 3. The order of draw prevents patient pain, cross-contamination of additives, clotting, hemolysis. Additives from one tube can affect results in the next. Question 4. Which tube is used for coagulation tests like PT/INR? Light blue, red, gray, tiger top. Light blue contains sodium citrate. Question 5. A hematoma is caused by too much suction, blood leaking into tissue, clean needle, fast draw. Commonly known as a bruise. Question 6. Which finger is preferred for capillary puncture? Thumb, index, middle or ring, pinky. Middle or ring fingers are standard. Question 7. The most common vein for venipuncture is basilic, cephalic, median cubital, radial. It is large and well anchored. Question 8. Applying the tourniquet for too long causes hemostasis, hemoconcentration, hematoma, hypoxia. It alters the concentration of blood components. Question 9. A timed test like glucose tolerance requires random collection, strict timing of samples, morning collection only, fasting for 24 hours. Samples are taken at specific intervals. Question 10. What does NPO mean? New patient only. Nothing by mouth. Normal pulse only. No blood draw. Patient should not eat or drink. Question 11. Hemolysis is the clotting of blood, destruction of red blood cells, fainting of patient, infection at site. Can be caused by shaking tubes or small needles. Question 12. Which additive is in a lavender tube? Heparin, EDTA, citrate, oxalate. EDTA is the anticoagulant for CBCs. Question 13. Specimen labeling should happen before the draw, in the lab, immediately after the draw at the bedside, at the end of the shift. Always label in the presence of the patient. Question 14. How many times should an EDTA tube be inverted? 1 to 2, 3 to 4, 8 to 10, 20. Proper mixing prevents microclots. Question 15. Syncope is the medical term for bleeding, fainting, nausea, pain. A common reaction to blood draws. Question 16. The correct order of draw starts with red, lavender, blood cultures, green. Cultures come first to prevent contamination. Question 17. Blood cultures are typically drawn in sets of 1, 2, aerobic and anaerobic. 3, 4. To detect different types of bacteria. Question 18. The butterfly needle is also known as straight needle, winged infusion set, vacutainer, lancet. Used for fragile or small veins. Question 19. What is the purpose of the tourniquet? Stop arterial flow. Enlarge the veins. Prevent infection. Identify the patient. It slows venous return, making veins prominent. Question 20. What is the first step in patient identification? Check the armband. Ask the patient to state their name. Look at the chart. Ask the nurse. Two-factor ID is standard.